Good morning. This morning we're going to talk about frostbite prevention. Now, in our part of the world, things can get very cold. And for those of us who work outside, there can be some very, very powerful effects as a result of having to be outside in adverse conditions for long periods of time. So this morning, I want to talk to you a little bit about preventing frostbite. It does happen in our part of the world. It can happen to you without you really being aware that it's creeping up. So let's have a talk about that this morning. Frostbite's caused by exposure to very cold temperatures. People who are elderly and people who are very, very young are particularly susceptible to it. Other risk factors include not dressing properly for the weather, and staying out in the cold too long, or getting wet while you're exposed to the cold. If you have a medical condition that can affect your susceptibility to frostbite, for example, people with diabetes or arterial sclerosis, those things, those conditions and other medical conditions may make you more susceptible to getting frostbite. If you've had a previous injury that was caused by the cold, once again, that's another gateway to you being susceptible to frostbite. If you take certain drugs, certain medications, this includes alcohol, nicotine, and other medications, perhaps beta blockers, those decrease the flow of blood to the skin. So these can be potential issues. So it's important to recognize the signs of frostbite so that you can seek medical help. If you need to, these symptoms include, for your understanding, the affected area will become numb. The skin may feel frozen, but deeper tissues are soft. That's a superficial kind of frostbite. Or the entire affected area feels solid, hard, and frozen. That's a deep sort of frostbite. The skin may appear waxy, white, or grayish. In order to treat this, seek medical care promptly if you suspect that you or someone that you're with has frostbite. In some cases, frostbite can have very serious long-term outcomes. The lack of blood flow and oxygen to the skin can cause the flesh to die, leading to permanent tissue damage. This may result in the need for amputation of the affected extremity. In some cases, an individual with frostbite will also develop hypothermia, which is another serious cold weather condition, and that requires emergency medical assistance. If medical care is not immediately available, follow these do's and don'ts for treating frostbite. Do bring the person indoors into a warm room as soon as possible. Do call for medical assistance immediately. While you're waiting for assistance to arrive, you can serve the person a broth or a tea or another warm drink. Do rest the injured area. Do remove any wet or restrictive clothing, and do gently rewarm the frostbitten area. To do this, immerse the affected area in warm, not hot, water for at least 30 to 40 minutes or until the area feels warm and sensation returns. During warming, be aware that the individual may complain of severe pain and the injured area may swell and it may change color. Do also prevent infection by leaving any blisters intact. Cover them loosely with a sterile or a clean cloth. Now, for the don'ts, don't do anything that will further injure the tissue. Don't rub or massage the frostbitten area with your hands, with snow or with anything else. Don't walk on frostbitten feet. Have the patient sit still with the feet elevated slightly. Don't warm the affected area if there's any chance that it will become exposed to the cold again. Skin that's warmed and then re-exposed can refreeze, and that will cause damage. So don't use dry heat, such as from a heating pad or a fire, a blow dryer, or a radiator, to warm the area. The skin may be numb and can then burn very easily. So as far as prevention goes, it's easier to prevent frostbite than it is to treat it. So if you must go out in the bitter cold, and we do, I understand, we spend a lot of time outside, observe the common sense precautions that will help ensure that your winter outings, whatever they happen to be, will end well. First, dress appropriately. Wear light, loose, layered clothing that provides both ventilation and insulation. Top off your outfit with water repellent or waterproof fabric. Protect your head, hands, and feet. Substantial heat loss occurs through the scalp, so a warm hat's vital. Mittens are warmer than gloves, and we sometimes can use those if we're welding, maybe not. Very often we just are confined to using gloves. 2 pairs of socks or pairs of socks, wool over cotton, will help keep your feet warm. Don't drink alcohol or smoke before going out into the cold. Alcohol, caffeine, and nicotine leave the skin more prone to thermal injury. And if you get wet, try to get inside, remove the wet clothing as quickly as possible, and check yourself every half hour or so for signs of frostbite. If your fingers, toes, nose, ears, or any other body part feels numb, then go inside and get warmed up immediately. I know this has been a bit longer than usual, but I hope that it will be useful to you. So try to consider these things carefully and try to avoid frostbite this winter during this cold weather period. Thanks very much.